The New York Citizens Committee on Healthcare Decisions is a grassroots community organization concerned with bringing provocative issues in healthcare policy and biomedical ethics to the general public. Senior Partners in Health, a special project of the New York Citizens Committee on Healthcare Decisions, is concerned with advanced care planning and the quality of doctor-patient working relationships. The key to good health care is a positive working relationship between physician and patient. But patients often feel intimidated when dealing with their doctors face-to-face, and many good doctors have limited communication skills. Attitudes toward the elderly also impinge on the care they receive. Because of scarce resources, the move towards managed care, and the acknowledgement of the patient's legal right to accept or reject treatment, there is an ongoing need to develop a model of care where patient and doctor work cooperatively. The program you will see today will increase your awareness of 4 common patterns of doctor-patient communication, sensitize you to the importance of active patient participation in decisions about your health care, provide you with a forum to share your experiences of managing your doctor-patient working relationship with other seniors, enable you to develop strategies for talking to your doctors and family members about your treatment choices and decisions at the end of life. This special project was made possible through a grant from the Open Society Institute, Project on Death in America. Scene 1.
Hello, Pat.
Oh.
What can I do for you today?
Well, Doctor, I'm having trouble with my ankles. They're swelling up.
Has this happened before?
Yes, a couple of weeks ago.
But the swelling went away.
Yeah, after a few days.
Is there anything else concerning you?
Yes. Last week when I went to the supermarket, I got so tired I had to sit down. Well, that just isn't like me.
Did you experience any chest pain?
Not really.
Did you feel dizzy or lightheaded?
Yes, a little lightheaded. And in the morning, when I get up out of bed, sometimes I feel dizzy for a second or two, and then it goes away. I'm frightened I could have heart disease like my parents.
You don't know any such thing, Pat. There are many explanations for your symptoms.
But these are some of the same symptoms my mother had before she died of a heart attack. And she was only 62.
Take it easy, Pat. I'm the doctor. From what you tell me, your symptoms suggest any number of common problems.
But doesn't the swelling mean I have heart failure?
No, it could mean you could have any number of things or nothing at all. The point is, it's my job to find out, and I certainly will.
Almost everyone in my family has heart problems. My older brother had 2 heart attacks last year.
Take it easy, Pat. You're getting upset for nothing. You've got to remember that it's my job to find out what's causing your symptoms. And if you need treatment, I'll decide what to do, and I'll make sure that you get the best treatment available.
So you're saying that even though I have a family history of heart disease, I have nothing to worry about?
I mean that we don't know yet if there's anything serious. Why worry until we know there's something to worry about? Trust me, Pat. Look, I can handle this. The first thing we've got to do is run some tests to see what's causing your symptoms. That's my first step. And your first step is to take a few deep breaths and calm down.
Okay.
We've talked about this before. Remember, you've got to stop smoking and watch your weight and make sure you exercise every day. And remember, at your age, you've got to take it easy, relax.
All right, Doctor, I'll try.
Good girl.
Oh, I almost forgot. My brother told me that after he had his heart attack, he talked to his doctor about planning for, when something happens to you.
Advanced care planning. You've got to plan for your future medically. Ask the nurse to give you the living will and healthcare proxy forms. After you've filled them out, they'll be in your file. But don't worry, I'm still going to take care of you.
So all I have to do is fill out the forms.
No, but that'll get you started. And then we'll follow up later.
Thank you, Doctor.
Bye, Pat.
Thank you.
Scene 2.
Good morning. Looks like you're not due for your annual checkup. What's your reason for coming in today?
Well, I have some symptoms that really frighten me.
Tell me all your symptoms.
Well, I'm a walker. I usually walk about a half mile, and I feel good afterwards. But last week, I had to stop and rest halfway through because I had trouble breathing.
Any other symptoms?
I don't think so.
Well, from what you're telling me, I can't be sure what's causing your problem, but of course I'll try to figure it out.
I hope that doesn't mean that I have to go through a lot of tests.
That's precisely what it means. A series of tests and an in-depth medical history covering your dietary habits, exposure to drugs and alcohol, smoking history, patterns of exercise, stress levels, your domestic situation, and your prescription and over-the-counter medications.
That's an awful lot, Doctor. What's wrong with me?
Well, as I said, I won't know until you've had a complete workup. But there can be many causes. Your blood pressure could be much too high, or angina could cause these symptoms. They can also be caused by aortic stenosis, edema, lung cancer, secondary to liver or kidney problems, or you might be anemic.
I'm sorry, Doc. I just don't know what you're saying.
I want you to know what you might be dealing with here. The nurse practitioner can answer your questions while she starts your tests.
I'm really confused.
It'll all clear up as we get more information.
Oh, there's one other thing that bothers me. My son told me that I should talk to you about advanced care planning, and I'm not sure what that means.
Well, Mr. Green, right now we have to figure out what's wrong with you. There's no point in discussing advanced care planning, CPRs, DNRs, etc. Those decisions are for the future. Right now, I'm concerned with your clinical condition.
I don't understand. I thought we could at least begin talking about advanced care planning.
Don't worry. You'll understand once we clarify your condition. The nurse will call you after we get your test results and schedule another appointment. Goodbye, Mr. Green.
Scene 3.
Hi, Ruth. How you doing?
Oh, the same old, same old. But I was walking to the post office last week, and I had a hard time catching my breath, and that's why I'm here.
Now, was that the first time?
Yeah, I don't understand. I've never had this problem before. I actually had to sit down to rest.
Now, did you feel any dizziness? Were you lightheaded? Did you have a headache?
Well, I did feel a little lightheaded.
Did you notice anything else?
At night, when I'm watching TV, I've noticed that my ankles are all swollen.
Ruth, I don't think there's much cause for alarm. It sounds to me that possibly your blood pressure is higher than it should be. Let's do an EKG, and we'll take your blood pressure again, and then we'll just see what we're dealing with. We'll take it from there. We don't want to miss anything. But let's also talk about some lifestyle changes and some choices.
Lifestyle changes and choices?
Well, what I mean by choices is, there may be several ways to treat your symptoms. Let's face it, Ruth, it's time to look at what you can do. And now what I'm talking about is weight control, diet, and your smoking.
Come on, John, you know me. That's dieting, exercise. That's not for me.
Well, Ruth. All right, for now, diet maybe isn't the most important item, okay? But let's at least try some exercise.
Oh, I don't think so. I'm too old. Can't you just give me a pill?
Okay, Ruth. Now, your blood pressure is slightly elevated now, but your EKG shows no significant changes. Now, given the situation, I feel that the best thing for you would be diet and regular exercise.
I really can't handle those kinds of changes. Why can't you just give me a pill?
Oh, Ruth. All right. If you insist, we can try, on a trial run, a mild blood pressure reducing drug. But it's not a substitute for change of habit. Now, Ruth, before you go anywhere, it's important for us to talk about some medical decisions that you should be concerned about. Do you have a living will or healthcare proxy?
No.
Well, it's important for us to talk now. These decisions will affect your care and treatment in the future should you ever become seriously ill.
Well, I don't want to talk about it now. I don't want to think about something that's that far away.
Okay. We'll talk about this later.
Bye, Doc.
Bye.
Scene 4.
Good morning, Mrs. Thomas.
Good morning.
How are you feeling today?
Oh, so. I'm worried that something's wrong.
Yes?
I just want to know what I can do to feel better.
Well, tell me about it.
Well, about a week ago, I was walking to the store, and I had to stop. That's how out of breath I was.
And since then, anything?
Sometimes my ankles swell a little.
Anything else unusual?
Yes, when I wake up in the morning, I'm a little dizzy. It only lasts for a minute or two.
Well, I'm glad to hear that you're paying attention to what your body tells you. We took a battery of tests when you were here a month ago. Let's look at what they showed. Well, they look pretty good. See, your EKG and blood pressure were normal. The blood work and other tests were fine. So there's nothing to be alarmed about. But because of what you're feeling, I would like to do another EKG and blood pressure evaluation to rule out any changes. We don't want to miss anything.
Yes, exactly. That's why I'm here. Living alone, I need to plan for any eventuality.
Yes. Well, we should consider two things, your present condition and your medical situation over the long run. I'd like to see you in a month for reevaluation.
Well, I'm concerned now. I don't want to wait for another month.
Well, fair enough. Come back in 2 weeks. Let's discuss right now your long-run situation. Regardless of today's tests, this is an issue that must be covered. Now, generally, people are concerned about what's going to happen to them if they get very sick. Have you heard about advanced care directives or a healthcare proxy?
About 10 years ago, I made a living will. But I don't think that's enough.
No, good. A living will is a good start. But you're right, it's not enough. A healthcare proxy ensures that your wishes will be carried out. It's vital. We can discuss it in detail, but we need more time than we have today. When you make your next appointment, be sure to tell the nurse to schedule enough time to include an advanced care planning session. Oh, and don't forget to ask for your Healthy Lifestyle for Seniors package.
I will.
So I'll see you in the examining room.
Thank you.